MD Doctor. Hello everyone. Today we group 4 will be discussing a very important topic in maternal and child health, which is prenatal care. Prenatal care plays a vital role in ensuring the health and safety of both the mother and the baby throughout pregnancy. With proper care, many complications can be prevented, detected early, or even managed efficiently. Today in this presentation, we will go through what prenatal care is, its importance, the schedule of visits, routine tests being done during the period, lifestyle guidance given to the mother, warning signs, and many more. Firstly, what is prenatal care? Prenatal care refers to the regular checkups, screenings, and health guidance provided to a pregnant woman throughout her pregnancy. The main goals of prenatal care is to monitor the health of both the mother and the fetus, detect any complications if there are any, provide education on healthy pregnancy, prepare the mother for labor, for delivery, and also postpartum care. It is a structural system of care designed to ensure the best possible outcome for both the mother and the baby. Coming to the initial prenatal evaluation, the first prenatal visit is usually the longest and the most detailed among all the prenatal visits. It includes mainly the medical history of the patient, which includes if the patient had any previous pregnancies earlier, and also it also includes the menstrual history of the patient. It includes the medical and any kind of surgical histories in the patient. It also includes family history to find if there is any genetic disorders. It also includes lifestyle habits of the patient like smoking, alcohol, and drugs. The next one would be physical examination, which measures the height and weight of the patient, which measures the blood pressure of the patient. It involves complete physical examination of the patient, whatever which is necessary, like the bimanual examination, and also it also includes pelvic examination. The next one would be laboratory test, which includes CBC, which is the complete blood count, blood type, and Rh factor. Screening for infections such as HIV, syphilis, hepatitis B, and for rubella. Urinalysis test, pregnancy rating using last menstrual period, and possibly ultrasound. The next one would be estimation of gestational age of the patient, determining the due date, and using Nagel's rule or ultrasound. The initial evaluation usually sets the baseline for monitoring throughout the pregnancy.
Definition of key term: gravida, number of time a woman has been pregnant; para, number of pregnancy has reached visibility 20 weeks or more; gestation age, age of pregnancy measured in week; trimester, the three distant phase of pregnancy; expect date of delivery, estimated due date; high risk of risk pregnancy, pregnancy with complication requiring closer monitoring. Important prenatal care: detect possible pregnancy complication earlier, reduce risk of maternal and infant mortality, ensure appropriate nutrition and supplement, monitor fetal growth and development, provides counseling on lifestyle change, offer vaccination and prevention care, prepare parents for the childbirth and newborn care.
This animation will show how your baby developing during pregnancy. Pregnancy usually lasts around 9 months or 14 weeks, and it's divided into 3 trimesters. The first trimester is from week 1 to week 12. The second trimester between the 13 to 27 weeks, and the third trimester is from 28 until birth. Here you can see the fallopian tube, ovary, womb, and vagina. A fertilized egg will develop and grow in your womb. and is known as an embryo in early week of pregnancy. By week 9, the embryo has been developed in a fetus. At this point, most of your baby organ, including his heart, are forming. By the time you are 12 weeks pregnant, your baby will be around 6 centimeters or 2.5 inches long. Your baby eyes are still closed. Its ears are forming. Here you can see the baby umbilical cord, the placenta, the amniotic fluid. The umbilical cord connect your baby to the placenta. This is the how your baby get oxygen and nutrition, and how waste such as urine remove in the second trimester. Your baby sex, organ development, and other organ mature. Your baby swallowing amniotic fluid passes through its digestive system. His or her kidney will start to work. Will pass small amount of urine. Your baby can now hear. It's covered in 5 layers of hair called langue. You will start feeling your baby moving during the second trimester. At first, this movement may feel like a butterfly or bubbly, but will get stronger, become more noticeable as you baby grow. You may start to have a Braxton a hic from 20 weeks. These are the painless tightening of your womb or practice contracting during the third trimester. Your baby lungs mature even though they didn't work properly until birth. His or her will started to open and close and their fingernail and hair will grow. Your baby fat storage will increase in preparing for the birth. Toward the end of your pregnancy, your baby will prepare for bearing by dropping down into your pelvic. It's now isn't long until you meet your baby.
Good afternoon. This is Dr. Jayashree Suman. This is my patient Mrs. Cortez, and we're gonna have today prenatal checkup on her. So, good afternoon, Mrs. Cortez. How are you feeling today?
I'm good. Just feeling the tired.
Okay. So, I'm here to check on you and your baby. So, if any time you have any questions or concern, please don't hesitate. Just let me know, and your comfort and safety is most important. Okay. So, Mrs. Cortez, I will be asking you your details. So, may I know your name, full name?
Yes, this is Baba.
Okay. What is your age?
20,
Okay. How many weeks pregnant are you?
22 weeks.
Okay. Mrs. Cortez, to make sure that your records are exact and accurate, may I confirm your full name and age?
Yes, my name is Lisa Cortez and I'm 20 years old.
Okay. So, how many weeks pregnant are you?
22.
Okay. So, this is your first pregnancy?
Yes, this is my first pregnancy.
Okay. So, do you have any complications till now?
No.
Okay. So, ma'am, may I know your last menstrual period? First day of last menstrual period?
Yeah, it was on June 24th.
Okay. So, have you had any prenatal checkup before?
Yes, I had one previous prenatal.
So, may I know where?
It was in private time.
Okay. So, how many weeks was during that time?
18.
Okay. So, are you taking any medication, vitamins, or supplements?
Yeah, I'm on supplements, vitamins, all of that.
Okay. So, did they advise for any supplements?
Yeah,
What, ma'am?
vitamins from the and other supplements necessary for pregnancy.
Okay. Iron.
Yeah.
Okay. Okay. So, you have any previous ultrasound?
No.
So, may I know that you have any food allergies to medications?
No,
or
I don't have any pregnancy.
Okay. So, have you been for gestational diabetes?
No, I'm not.
So, okay, ma'am. So, So since your last visit, how are you feeling?
I got occasionally vomit.
Or else everything is fine? Like, do you experience any dizziness, headache, or visual disturbance? Okay, no. So, just mild nausea in the morning and vomiting and dizziness. Okay. So, any swelling on your hand or feet or face?
No, I don't have it.
So, have you any having any vaginal discharge, spotting or leakage of fluid or any abnormal discharge, unusual discharge?
No, I don't know.
So, I would like to ask that do you have any abdominal pain, cramping or tightening or any kind of contractions? Okay. So, any difficulty in pain while urinating?
I don't feel any discomfort while urinating.
So now, how is your appetite? Are you able to maintain your regular meals?
Yes, I'm eating regularly.
Okay. So, how does a typical day eating look like for you?
I take 3 times, more than 3 times a day with rice, vegetables, fruits, and sometimes with chicken and fried fish.
So, are you doing any light to moderate physical activity such as walking or stretching?
Yes, I used to walk around garden like around 20 to 30 minutes.
So, do you smoke, drink alcohol, or you have any?
No, I don't smoke.
So, do you have any reaction to any substance?
No.
So, how is your sleep? Are you able to sleep very well?
Yeah, I used to sleep good, like sometimes in morning, late night I used to wake up.
So, at home, who supports you emotionally, physically, and during your pregnancy?
My partner and my family.
So, do you feel safe at your home?
Yes.
Ma'am, now I will be examining you. So, are you comfortable? So, ma'am, what was your last BP?
It was normal.
So,
120.
okay. So, was there any episodes of high blood?
No.
Okay. So, can you open your specs? May I know your weight before pregnancy?
60.
Okay. So, what is your current weight?
65.
No, I will check your baby's heartbeat. Okay.
Obstetric examination. So after confirming all the details, I am telling her here that I will be having a feel for her tummy, checking the position of the baby and also listening to the heart rate of the baby. Also ask her to would she like to empty her bladder before proceeding with the examination. Next, we need to make sure that we have all our equipments available: the pinard, stethoscope, the handheld fetal Doppler monitor, lubricant gel, measuring tape, gloves, and hand sanitizer. Then we want to make sure that the couch is arranged in a 15A angle. We should avoid aortic cable compression. So beyond 20 weeks of gestation, the pregnant uterus applies pressure over the inferior vena cava and aorta. As you might imagine, the pressure is more pronounced when the mother is lying flat on her back, compressing of the vena cava, resulting in decreased venous return to the heart and therefore limits the blood flow out to the placenta, and the mother can be cause maternal hypotension and fetal distress. Therefore, we always examine pregnant patient with the bed arranged at the angle back to the video. So next we are going to start off by sanitizing our hand, then helping the patient onto the couch, making sure that she is comfortable, and then asking her if she is okay to proceed with the examination. Therefore, gaining consent, we all start off by looking at her hand. So over here I started off by palpating for the radial pulse. We can also take a look at the color of pale hand. For example, might be a sign of hypoperfusion. Peripheral edema can be normal in the late pregnancy, however can be a sign of preeclampsia. Pulmonary edema can also be a normal finding in pregnancy. Other findings of note include temperature and capillary refill time. Next we will check So now we can proceed to the abdominal examination. So here we set our patient to uncover her tummy, and we want abdomen to be exposed from the pubic symphysis to the sternum. And next we can proceed with this inspection. So of the course we can notice the abdomen is distended and compatible with pregnancy, and we can see the linea nigra here. As you can see, there is a pigmented line going down to the maternal abdomen, which occurs because of increased melanoid stimulating hormone produced by the placenta. That umbilicus is inverted. We always should look for any scars over her abdomen, and we should also take a note for any possible laparoscopy scar, fish scale scar, or use for previous cesarean section. Fetal movement might be visible as well. ST gravidum, which is patient does not have static gravidum. So ST gravidum is basically a medical term for stretch marks. They tend to be red when fresh, when therefore from the current pregnancy, or white when they are rolled from a previous pregnancy. And these white ST are known as T obliquans. Next we are going to start with the palpation. So starting off with the palpation for the fundus of the uterus using the inner border of your left hand, starting the from the externum, making your way down until you feel a hard surface, which is the fundus of the uterus. This will help us for the next step, which is measuring of the symphyseal fundal height. And so here we are measuring the distance from the symphysis pubis up to the fundus and of the uterus. So I am keeping the measurement tape inside up, not to the sheet, but we are interested in the centimeter measurement. The gestation in the week should be equivalent to the synomos fundal height. After around 20 weeks on the average, a 20-week pregnancy should reach the level of the umbilicus, and 36 pregnancy should reach the sternum. As you can see the image, as the pregnancy processes, the measurements start decreasing in the size, and this is because of the movement of the fetal head down in the pelvic. And we also have next we can proceed with determining how the fetus is positioned inside the uterus. But first, a quick revision starting with the fetal lie. So the fetal lie refers to the relationship between the long axis of the fetus and the long axis of the mother. Therefore, the fetal lie could not be the longitudinal oblique but the transverse presentation. Refer to the part of the fetus in the lower part of the uterus, and therefore closets the maternal pelvic. This could be a calic presentation, which the head is presenting a beach presentation with the bone of leg presenting. There may be no fetal parts in the lower portion of the uterus, as you can see that here with the transfer lie. Another option is also a shoulder presentation. So back of our examination once again, how do we determine these examination findings, which are very important, detecting possible changes in the mode of delivery. So starting with the fetal lie, so I place my hand on either side of the uterus, always ensuring that my left hand is on the left side of the uterus and the right hand is on the right side of the therefore I am always facing the mother and never facing away from her. Then you can see that I keep one hand held in the same position while other is feeling the fetal parts from the top to the bottom of the uterus. One side they will repeat the same on the other side, and here I am trying to palpate for a smooth surface on the side which will represent the back of the baby, and the other side of the uterus should feel more empty or not smooth, but due to the presence of limbs. Next we want to feel for the presenting part, and we have two maneuvers which we can perform in the case we have a pollux creep, and there we can use the thumb, third finger on the side of presenting the part to the palpate it. Before performing the maneuver, we need to for the patient that there might be a bit comfortable. A head typically feels like hard, like a tennis ball, while a boom tends to feel softer, or else you can palpate the presenting part using both hands from the top. And however, I tend to prefer the first option. Now late pregnancy, we also access the for engagement, and engagement referred to the descent of the presenting part into the maternal pelvis in correlation to the pubic symphysis in the measuring to palpate, and fits referring to the 5 fingers. Therefore, to access for engagement, you place your right hand above the pubic symphysis and access up which fingers the pressing part is palpable, and if not engaged, fifth of the presenting part is palpable. If we engage, for example, only 2/5 of presenting part is palpable. Finally, on the abdomen, we are going to listen to the fetal heart. Over the here we have got a fetal Doppler monitoring, which is used merely for auscultation if it does not give any further information regarding the fetal heart rate. We position the probe over the anterior shoulder, and we can decipher where the anterior shoulder is located depending on our previous examination and our estimation of the location of the back and the head of the baby. Once in that position, we keep the probe in the place and rotate around until the fetal heart is audible. While doing this, we should always compare this heart rate with the maternal pulse to ensure that they are different. The fetal heart rate should be faster when compared to the maternal heart rate. So now we are going to take a look on her legs. So first we should try to uncover them identically. We get the leg uncovered until above the knee. We inspect them first and notice any discoloration, anemia or obvious swelling. Next to we can access for edema by placing your index and third finger over the tibia and press downwards. Then lift up and then look for indentation on the skin. And this case we notice immediately that she did not have mild edema, or you can have. As you can also see, there are marks from her socks, so we can also access for the deep vein thrombosis, and by accessing any kind of tenderness. By this we complete our complete examination, and we thank our patient for cooperation.
Okay, ma'am, we are done with your physical examination. So now I will provide you some kind of counseling. In that, I will encourage you that you please have balanced food. You includes fruits, vegetables, and whole grains, lean protein, and then again dairy products. Okay, whatever you are taking, continue that in good amount. So please continue taking your prenatal vitamins, especially folic acid and iron supplements and calcium. Okay. So again, I will also advise you, please drink plenty of water and rest well, and also engage in light kind of exercise. Do not lift something heavyweight, and then again please avoid smoking, drinking alcohol or any kind of drugs. Okay, so this is very serious thing, ma'am, and it will seriously affect your health and your baby health. Okay.
That's true.
So again, I will also tell you that if there is any kind of severe abdominal pain or any kind of bleeding or any kind of swelling on your face or your hands or your legs, please just visit us. And then again, if you feel any kind of fever or chills or fluid leakage, just try to immediately visit nearest hospital, or you can call me. Okay, so again I will also schedule your follow-up schedule. So from now, ma'am, normally there will be 4 weeks until every 4 weeks until 28 weeks. Okay.
Okay, ma'am.
So again from that time, every 2 weeks from 28 to 36 weeks, and then again weekly from 36 weeks. So if there will be any risk factor, then we can also schedule your frequent schedule for visits. Okay. So also understand, ma'am, that pregnancy can bring many emotional changes. It is important to talk about your feelings and have support from your partner, family or friends. Okay. So please let me know if you feel any time overwhelmed or any. Okay, ma'am. Today we checked your vital signs, your baby heartbeat and your abdomen, and overall well-being. Everything looks good unless otherwise noted. And if I will give you any next appointment and next day, please return earlier if you experience any warning signs before the one I advised you before. Okay?
Okay.
Or you have any kind of concerns. So again, before we finish, you have any questions?
No, no.
Okay, so are you comfortable? Everything is okay? Okay, ma'am, I will also review your lab test. So please have test for CBC, serum electrolytes and glucose test. I will also advise you to have GDN screening. Okay. Then after you get your results, you should have follow-up for after 1 week. Then I will schedule your ultrasound. Okay? Okay, ma'am, everything look nice. You are healthy and your baby is fine. So I would like to thank you for coming today. You are doing a really great job taking care of yourself and your baby. Please take care. If you feel any abnormalities, if you feel any discomfort, please reach out to us and your family members and your husband. We will see you at your next visit. Okay, ma'am?
For the vaccination, safe and important vaccine during pregnancy include first of all, Tdap vaccine recommended in every pregnancy 27 to 36 weeks. For the influenza vaccine at any stage of pregnancy, and COVID-19 vaccine as recommended by health authorities, and avoid live vaccines like MMR and varicella during pregnancy. For the lifestyle and recommendations, healthy practice regular light to moderate exercise, adequate hydration, sufficient sleep, stress management, and attending childbirth classes. And what in the avoid smoking and secondhand smoke, alcohol and recreational drugs, and heavy lifting and excessive heat exposure like saunas and hot tubs.
Warning signs. Seek immediate medical attention if any of the following: vaginal bleeding, severe headache or visual change, painful contraction before 37 weeks, decreased fetal movement, severe abdominal pain, high fever, leakage of fluid, sudden swelling of hand, face or feet, signs of preeclampsia, elevated blood pressure or protein in urine. Conclusion: prenatal care is an essential component of a healthy pregnancy. It ensures the well-being of both mother and baby through regular monitoring, testing and guidance. By understanding the value of prenatal visits, proper nutrition, lifestyle management and recognize warning signs, we can significantly improve outcomes for mother and newborns. Prenatal care is not just medical, it is an improving journey toward safe and healthy children. Thank you.